Hello, everyone. Today, the turn is for chapter number 8, Drugs for Disorders Associated with the Autonomic Nervous System. So let's talk about a little bit of that is nervous system. In this chapter, we're going to be learning first for the two primary divisions of nervous system, three primary functions of nervous system. We will compare and contrast the actions of the sympathetic and parasympathetic nervous systems. And we will understand three parts of the synapses. We will identify the neurotransmitters important to the autonomic nervous system and the types of nerves with which they are associated. We'll compare and contrast nicotinic and muscarinic receptors. We'll compare and contrast the types of effects when a drug stimulates alpha 1, alpha 2, beta 1, and beta 2 adrenergic receptors. For each of the classes in the summary drug table, explain the mechanism of drug action, primary actions, and important adverse effects. The first is neuropharmacology. Neuro means nervous system. Pharma means medicine. Pharmacology is study. The study of the brain or nervous system medicines is this. It is the largest, most complicated, and least understood branch of the pharmacology. Medications treat pain, anxiety, depression, schizophrenia, insomnia, and convulsions. Through their effects on the nerves, the drugs treat diseases of other organ systems as well. If we talk about the nervous system, when talk nervous system, usually a normal person says we are talking about brain. But no, not only the brain. The nervous system is divided into different components. Number one is the central nervous system and a peripheral nervous system. So central nervous system will contain the brain and the spinal cord, and the peripheral nervous system will contain all the nerves working into them. So central nervous system, brain, spinal cord. Peripheral nervous system is further divided into a somatic nervous system and an autonomic nervous system. This is a cell division. This is a division that's explaining CNS and peripheral. So if you look at the central nervous system, brain, which receives and processes the sensory information, it initiates the responses, it stores the memories, it generates the thoughts and emotions. Spinal cord is the one which conducts the signals to and from the brain, and it controls the reflex activities. And PNS is called as peripheral nervous system, which is further divided into CNS and the body system, motor neurons, sensory neurons. So when the signals are going from the CNS to the body muscles, to the body glands, that path, that neurons are called as the motor neurons. The neurons which take the signals from the sensory organs, like all organs of the body, back to the CNS, which is called as sensory neurons. So we have two types of nerves in our peripheral nervous system, motor nerves, sensory nerves. Motor nerves which take the message from the brain to the body, and the sensory nerves which take back the signal from the body to the brain. Now, motor neurons are further divided into a somatic nervous system and an autonomic nervous system. Autonomic, it means it controls involuntary responses. How we are digesting the food, how the liver is functioning, how the kidney is functioning, how our heart is beating, how our brain is functioning. Do we know anything? No. Everything is going inside the body and it is not our control. So it is an involuntary response. So all the involuntary responses, what is happening inside our human body, it comes under the autonomic nervous system. Somatic nervous system controls the voluntary movements. You want to speak, you want to move your head, you want to move your arms, legs, you want to do any kind of movement, grabbing something, pinching something. They all movements which is under your control, they are under the somatic nervous system. Now, autonomic nervous system is further divided into two, sympathetic and parasympathetic. Sympathetic is called as a fight or flight response, and parasympathetic is rest and digest. When we are sleeping, our autonomic nervous system is working, but which part is working? Parasympathetic. When we are working, walking, doing anything during the day, that is a fight or flight response, then at that time, the sympathetic division of the autonomic nervous system is working. Now, functions of the nervous system altogether, they recognize the changes in the internal and external environment, what is happening. They process and integrate these environmental changes, and they react to the environmental changes by producing an action or response. The autonomic nervous system, we talked about sympathetic and parasympathetic. Once again, sympathetic is a fight or flight response. Parasympathetic is a rest or digest system. Now, sympathetic is only at the times of stress. Parasympathetic system works when there are non-stressful situations, when you're sleeping, resting, watching TV, relaxing. Now, look at this division. One side we are talking about parasympathetic and the other side is sympathetic. Parasympathetic is rest or digest. What happened? In the rest or digest situation, our pupils of the eye are always constricted. In sympathetic system, they always dilate. When we are under stress, our pupil dilate. When we are relaxing, our pupil constricts. When we are relaxing, it stimulates the salivation. We get the saliva in the mouth. But fight or flight response gives you inhibition of the salivation. If there is a stress, we don't have much saliva in the mouth. We have a dry mouth. We need to drink water. Resting stage causes the slowing of the heart. Slowing of heart means making the normal function of the heart. And the stress conditions makes us as the heart accelerating, fast beating of the heart. That's why when we are in stress, when we are in anger, anxiety, we always have a heavy heart. Constrict bronchioles, that is the lungs. Rest or digest, our bronchioles are constricted. And in the stress, our bronchioles, they dilate. We need to take deep breath to control our anger and that's why we say deep breathe. When somebody is in the stress or anger or anxiety, we say deep breathe. Deep breathe. It will constrict your bronchioles and you will go back into the rest and digest stage. Then they stimulate the digestion and it inhibits the digestion in the stress. Our gallbladder close to the liver, which gives the secretions, it also stimulates stimulates the release of the glucose into the body. That's why stress causes the diabetes mellitus. Stress causes the sugar, because whenever there is a stress, there is a release of extra glucose into the body, and then we don't have so much of the insulin to block them. So we have more blood sugar levels in our blood. Next is when we are in stress, we secrete the epinephrine and norepinephrine. These are the neurotransmitters. We will discuss about it. They relaxes the bladder and they contracts the bladder. They stimulates the sex organs and they inhibits the sex organs. The next thing to understand is this is the spinal cord. In the spinal cord, on the top, we have the cranial nerves. Then we have in the cervical area, cervical nerves. In the thoracic area, thoracic nerves. And the lumbar area, the lumbar nerves. So epinephrine, bladder, and sex organs, they're controlled by lumbar nerves. The green, all these, they are controlled by thoracic nerves. And resting stage is controlled by the cranial nerves. So when we are in stress, that's why our body gets stiff. Because our vertebra get stiff, because all the vertebra in the thoracic nerves are present there, they all get disturbed in the sympathetic or stress or the fight or flight response. Now, autonomic nervous system, it's under involuntary control once again. It is affecting our smooth muscles, cardiac muscles, for our heart and for the glands as well. Branches for the autonomic nervous system is, again, they are repeating sympathetic, that is for stress, that is fight or flight. Parasympathetic is the rest or digest. Almost all organs and the glands, they receive the nerves from both the branches. Now, synapses, a new word. Synapses are the common sites of the drug action. What are synapses? Where are they present? Let's talk starting from a neuron. So what is a neuron? As our body is made up of a cell, Our all body organs are made up of a special cells, and those cells have their names. So when our brain started making up in our body, they started up with a small cell, and the functional starting cell of the brain is neuron. It transmits the information throughout the nervous system, and it transmits the information to the whole body, to the muscles, to the glands, everywhere. Synapse is the area at the end of the neuron. So neuron is a cell, and at the end of the cell, that area is called a synapse, kind of a junction. So junction or synaptic cleft. So what is synaptic cleft? When one cell and two cells, one neuron and two neuron, they combine with each other, they have a little gap in the middle, they have a little space between them. So that space between the two neurons is called a synaptic cleft. Nerve impulses must cross to reach the next neuron. They have to pass through the synaptic cleft and then they go to the next. Presynaptic neuron, as the word we use pre. Pre means before. So when anything has to enter into the synapse, that is called as before the synapse, that is presynaptic. And before the synapse is always a generation of the original impulse. Now look at this picture. This is a ganglionic synapse. Now this is a complete, it looks like a tall, a long thing. This is a cell which is called as neuron. This is a brain cell. We have millions of neurons in our brain. They are our information centers. On the one side, you can see these finger-like projections, and on the other side, it's normal. So one end, which is normal, it always combines with the finger-like projections, and that's how all these neurons are interconnected with each other. Now, every neuron, when they are connecting with each other, the space between them is called a synapse or ganglionic synapse. Before that portion is called as preganglionic, and on the other side of the synapse is called as postganglionic. This is a spinal cord. Let's say from one side the signal is coming, that is spinal cord. It is coming inside, going to preganglionic neuron. The signal is going to synapse, then going to the next neuron, and then into the axon, and it goes at the target tissue. And that's how the impulse is moving. Now, acetylcholine and norepinephrine. They are the two primary neurotransmitters in the autonomic nervous system. Now, what are neurotransmitters? Neuro means nervous system. Transmitters means which transmit the information from the one part to the other part of the body. So there are some neurotransmitters in the body, like acetylcholine and norepinephrine. There are others as well. Some are the happy neurotransmitters, which changes our mood happy. Some are the sad, they made our mood sad. Now, these are the chemicals, the neurotransmitters. These are the chemicals actually. They are released by the presynaptic neurons. Now, I think you understand when I say presynaptic neuron. So they are released from the start of the neuron and they go into the synaptic cleft. Over there, they attach to the receptors and then go on to the postsynaptic neurons, and then they regenerate the nerve impulse. I hope you are understanding the way that they are moving now. Now, first is norepinephrine, which is also called as NE, N for nor, E for epinephrine. They are released by sympathetic, that is fight or flight, at the time of the stress. So norepinephrine, neurotransmitter, is always released by our body when our body is under stress, when we are under anxiety. They're released by sympathetic nerves. The sympathetic nerves has another name, which is called as adrenergic nerves. These are the two different names, but the same meaning at the synapse with organs. Now, acetylcholine, it is released by all presynaptic neurons, no matter what, if it's a stress or it's a rest, it is released by all presynaptic neurons at synapse with ganglia. Now, acetylcholine is a neurotransmitter. Where? At the cholinergic receptor. I'll go back onto the slide. When we say they go to these neurotransmitters are released. Now, anything that is released, they are going to be received by someone. Whoever receives them, they are called as receptors. So there are cholinergic receptors, which receive the signals or the neurotransmitters they are coming. So cholinergic receptors receives which neurotransmitter? That is acetylcholine. And acetylcholine is the one which is released by all presynaptic neurons. So at the cholinergic receptor, the acetylcholine neurotransmitter is received. Now, the cholinergic receptors are further of two types: nicotinic receptors and muscarinic receptors. Now, where are these? What they do? Nicotinic receptors, they are found in all our body skeletal muscles and all over the ganglia. Muscarinic receptors, they are present at the end of the postsynaptic neurons in the parasympathetic nervous system only. Right? N receptors, M receptors. Nicotinic present in the ganglia or skeletal muscles. Muscarinic receptors, they're at the end of the postsynaptic neuron where the neuron is ending, but especially in parasympathetic nervous system at the resting stage. Then is the adrenergic receptor. I'll go back for a minute. Adrenergic receptors here. Adrenergic means sympathetic at the time of stress. So adrenergic receptors means they are taking the neurotransmitters, they're receiving the neurotransmitters at the time of stress. So norepinephrine is a neurotransmitter which is secreted at the time of stress, and they're received by the receptors named as adrenergic receptors. Now, adrenergic receptors are further of two types: alpha receptors or beta receptors. Alpha receptors are further alpha 1, alpha 2. Beta are further beta 1 and beta 2. So alpha receptors and beta receptors, these are adrenergic receptors, and they receive the neurotransmitter norepinephrine, which is always released at the time of the stress. Now, this is the sympathetic pathway. Spinal cord is giving the cholinergic preganglionic neuron. Acetylcholine neurotransmitter is here. In sympathetic pathway, acetylcholine. In parasympathetic, acetylcholine. Because if you remember, acetylcholine is at both ways. But now, when it moves to the next, it is going to the cholinergic receptor, nicotinic receptor. Then it is going over to adrenergic neuron, and a norepinephrine is released. But when it is a parasympathetic pathway, it is a resting stage. Look at here. At the resting stage, at when the brain is at rest, we don't have norepinephrine, because norepinephrine is a stress-released neurotransmitter. We have only acetylcholine here at the muscarinic receptor. Now talk about alpha receptors in the sympathetic or adrenergic receptors. So alpha is the adrenergic receptor. Alpha 1 is present at all sympathetic target organs, all the organs which are targeted at the time of stress. And which organs are targeted at the time of stress? The picture that we see in the start, it was showing us that it constricts pupil, eye is targeted, heart is targeted, lungs are targeted. So everywhere, heart, lungs, eyes, which organs are targeted by the stress, by the sympathetic nervous system, they all have alpha 1, except the heart. Heart is, they are telling us, is an exception. Alpha 1 are not present on the heart. Alpha 2 are always present on the presynaptic adrenergic neuron terminals. Now again, the beta 1, they are always present on heart and kidney. Alpha 1 is not present on heart. Beta 1 is present on heart. Beta 2 is the same as the alpha 1. They are present on all sympathetic target organs except the heart. Now, types of autonomic receptors. We were literally talking about this. Acetylcholine is a cholinergic neurotransmitter. Norepinephrine is an adrenergic neurotransmitter. I'll remind you again, acetylcholine is released when the body is at rest at parasympathetic target organs. Norepinephrine is released under the stress by sympathetic nervous system. So acetylcholine, they got two receptors, muscarinic and nicotinic. Norepinephrine, they got four receptors, alpha 1, alpha 2, beta 1, and beta 2. So the primary locations we had already discussed about, they are present at the target organs other than heart. They causes now what they do there, they stimulate the smooth muscle contraction and the gland secretion. If you remember that picture again, parasympathetic, what they do, this stimulates the gland secretions, this stimulates the saliva, and they also decrease the heart rate, they slow the heart and force of contraction in the heart. If the acetylcholine is acting on the nicotinic receptor, they will act on the cell bodies of postganglionic neurons, sympathetic and parasympathetic pathway. What they do the same thing, stimulation of the smooth muscles, contraction and gland secretions. If you remember, I will remind you again here. This picture, look at that, stimulate. Stimulates the secretion because it's parasympathetic. Slows the heart, decrease the heart functions. That's what we are talking about here. Similarly, norepinephrine, it's a parasympathetic, it's a sympathetic released at the time of stress. It's an adrenergic neurotransmitter. When it is going at the alpha receptor, alpha 1, all sympathetic target organs, they constrict the blood vessels. Again, if you go back to, always there is a constriction of blood vessels and dilation of pupils. When alpha 2 is working at presynaptic adrenergic neuron terminals, they will always do the inhibition of norepinephrine release. They will block. Beta 1 is acting on heart and kidneys, and they always increase in heart rate and force of contraction and release of renin in the kidney. Beta 2, it's all sympathetic target organs except the heart. Inhibition of smooth muscle contraction. Next is, autonomic drugs are classified according to the receptors they stimulate or block. Now there are four actions. Number one is the stimulation of sympathetic nervous system. For example, sympathomimetics, now another name given to the adrenergic drugs. Adrenergic drugs, they act on them and they stimulate the sympathetic nervous system. They are also called as sympathomimetics, which mimic the action of, mimetics means mimic the action of sympathetic nervous system. They engage the fight or flight response. The other ones are stimulation of parasympathetic nervous system, cholinergic agents, parasympathomimetics, they mimic the action of parasympathetic nervous system. They engage rest and digest response. Inhibition of sympathetic nervous system, adrenergic blockers or sympatholytics oppose the sympathetic response. Inhibition of parasympathetic nervous system, they are cholinergic blockers because they are inhibiting. Anticholinergics, then is another name, and they oppose the parasympathetic responses. So these are the four different kinds of the drugs which shows four different kinds of actions. Parasympathetic nervous system, it stimulates parasympathomimetics, cholinergic agents. It's kind of a review for the previous slide. Inhibitions called as anticholinergics. Sympathetic nervous systems, if they stimulate, they're called as adrenergic agonists, sympathomimetics. Sympatholytics, they're quite confusing, but if you try to understand the concept, write it down on a paper, it becomes easier for you then. Parasympathomimetics, they have the few therapeutic uses because of their numerous adverse effects. We are talking about first parasympathomimetics. Now, direct acting parasympathomimetics. So there are two different kinds of, one is direct acting, they're directly acting on them, and the other is indirect acting. So if it is directly acting, they are mimicking the action of the parasympathetic nervous system. They are used only in the clinical setting. They have the serious adverse effects. They also reduce the intraocular pressure in the glaucoma. They stimulate the smooth muscles in the bowel and urinary tract after the anesthesia. So they stimulate these things. Indirectly acting are always acetylcholinesterase inhibitors. They facilitate the effects of the acetylcholine neurotransmitter and they induce the actions associated with the rest and digest. What are they used for? They affect the acetylcholine receptors in skeletal muscles. They're used with myasthenia gravis disease. This is a muscular disease. They stimulate the skeletal muscle contractions. They temporarily restore the muscle strength. And the examples of the drugs are pyridostigmine, which is a brand name Mestinon, neostigmine, which is the brand name prostigmine. Adverse effects are increased salivation. Remember, increasing. So parasympathetic effect. If you remember the chart, the first chart, you remember everything. Adverse effects, they increase the saliva, they increase the sweat, muscle twitching. They does the involuntary defecation and urination because your bladder constricted. They causes confusion. They causes convulsions as well. The next one we'll do in the next part.